I'm Dr. Jill Wener. I'm a physician, meditation teacher, tapping practitioner, author, podcast host, and I'm going to be doing a series of videos coming up the next couple weeks on tapping that you can tap along with that are free, that are going to be ways for you to help manage your emotions in these difficult times. I've been hearing from so many people that like the regular self-help tools and techniques they're using just aren't cutting it anymore. And I actually feel the same way. For me, it's meditation and tapping, and I found myself needing extra tools as well. So for anyone wanting that, I'm going to talk a little bit about the introduction to tapping today, what it is, how we use it, so that for the next videos, we'll just be able to jump right in, and rather than me have to explain it each time. A quick reminder, this is not a substitute for medical care or mental health care. And if there is something going on in your life that is much more significant, or you're having thoughts of hurting yourself, please do contact a mental health professional or call 911. And this video doesn't imply any sort of medical patient, doctor, or client practitioner relationship between us. Please clean your hands if you haven't already, because we'll be touching our face during this, and for all future videos. Tapping is also called the emotional freedom technique. It is a technique that is evidence-based. There's evidence that shows it decreases cortisol, which is the stress hormone. It has changes in functional MRIs, changes in the brain. And the way it works is it uses the same energy centers or meridians that are in traditional Chinese medicine and acupuncture, but instead of using needles, we tap on these points. So it's acupressure. The way that we do it is there's lots of things that I do when I work with my clients one-on-one. But other things can be done more in a group setting. And so this of course, when I do these videos, they are going to be without getting inside the brain of anyone that I'm working with. But it's call and response. So I'll say something from first person, and then whoever's doing this video, you would be repeating back in first person. If I say something that doesn't resonate, change what I'm saying. Tapping can be used for trauma, for post-traumatic stress or PTSD, phobias, for self-limiting beliefs, to overcome obstacles in life, to get over breakups, to move on after a big life transition. So many different things. It can be used for acute and chronic pain. It can help shift mindset. It can be used to manifest positive things in life. So there's lots of things that tapping can be used for. And it can also be used really, really well for symptom management. I've been doing it a lot during COVID to help people manage a lot of the emotions that have been coming up, ranging from anxiety to loneliness, to fear, to anger, all sorts of things. So to give you a little bit of the background of tapping, and if you want to look up more, Google emotional freedom technique. You can go to Google Scholar and type that in. If you type in tapping, you're not going to get much. So the points that we use to tap are mostly on the face and chest, and there's one on the hand. You can use either hand, or you can use both hands whenever it looks like appropriate. If I'm going under this eye, you can go under both eyes. I typically just tap with my right hand on the right side of my body, but sometimes we'll cross over and do the right hand on my left side of my body. So you'll see what I'm doing. I'm going to lower my video so you can see all of it here. The first one is here. It's called the karate chop point. And the importance with tapping is you have to tap and talk at the same time. I'm not going to actually do a tapping sequence now. That'll be coming soon. But just so you get a sense. So here, the side of the hand is called the karate chop point. The next one is top of the head. Inner corner of the eyebrow. So from a medical professional's medial corner of the eyebrow, where the eyebrow ends and then hits where the nose is. So you tap here. Side of the eye. Under the eye, and remember you can do both hands for these that are on one side. The next one is under the nose, and it's probably best to just do one hand here. Chin. The next one is the collarbone. So if you go, but it's not actually on the collarbone. So if you go to this little notch here in your chest, go down an inch and over an inch on either side. You can make a little C out of your hand and tap like that. I like to make a fist and tap like that. I kind of keep my elbow in and tap like that. And then the last one is the bra line, or under the arm, the bra line where it would the bra is or would be. You can tap. I like to get my fist kind of like that and tap like that, but you can also tap with your fingertips or reach across and tap on your fingertips like that, whatever's most comfortable. So those are the tapping points. That's a little bit about tapping. It can be extremely effective in managing symptoms. And so again, I'm going to be posting some videos, sending some videos out about this over the next couple weeks that are a great free resource for you. If you're interested in learning more about tapping, you can go to my website, jillwener.com/tapping. I have a couple online courses about tapping. One is how to create your own tapping sequence. One is a physician's guide to burnout using tapping. And I also do one-on-one tapping sessions. And that's all available on my website, again, jillwener.com/tapping. If you have any thoughts on emotions that you would like to see me leading a tapping session on, please do let me know, and I'll do my best to accommodate. And I look forward to seeing you in future videos.